25 years ago, there was a young couple sitting in a doctor's office waiting for the 8-month checkup. They were very excited when they arrived, but when they left, they did so shocked and upset. When the doctor came in for their checkup, she induced the woman a month early. This cost the woman 24 hours of grueling labor and the baby to be born with a misshapen head. That couple was my parents, and that baby was my brother. There are many women in that scenario that are unaware of the effects of medical intervention in childbirth. Those women think that it's the doctor's way or the highway and that their opinion doesn't hold any weight. We need to raise awareness in the other options. I know what you're thinking. When I say natural and childbirth in the same sentence, you draw up an image in your mind of chanting and chicken blood in the delivery room. This actually isn't the case. Natural childbirth, as described by the English Oxford Dictionary, is with minimal to no medical intervention with a focus on what feels natural for the mom delivering. Although there are cases where medical intervention is necessary, women's bodies are designed to do it naturally, without any help. At some point in our lives, we will know somebody who is pregnant, or we will be pregnant ourselves. It's time to know what's going on in the delivery room, and it's time to know the options. Now that we're on the same page, let's look at how medical intervention can be harmful. The U.S. is a huge leader in the world, and as an industrialized country, they're lacking severely in the delivery room. Infant mortality rates, as recorded by an online consumer report, stated that in Canada, those rates are 25% lower than in the U.S., and in Japan, 60% lower. Medical intervention is becoming the new norm in our society today. In the 17th century, women who were pregnant would give birth to their children with no interferences and no pain medication. They would wait for when their body was ready, and then they would go. Women currently are induced at 37 weeks pregnant, while a full term is 40 weeks long. Also stated in a consumer report regarding childbirth, from 1990 to the year 2007, induced pregnancies increased by 45%, while full-term pregnancies dropped by 26%. And there's got to be a reason why hospitals are pushing this agenda. That's where convenience trumps quality. There is something very attractive about making a delivery schedule, knowing when a certain mom is coming in at a certain time to deliver her baby and will be out of the hospital by the next day for the next mom to come in and have her baby. The cycle goes on. They are becoming so used to this schedule that the convenience of this schedule for them is trumping the quality of the labor for the mother. When forcing a woman's body to do something that it isn't ready for, it causes a lot of medical repercussions, and it's something that the moms have to answer for. Marie Mongan, an award-winning therapist with over 30 years of teaching at a collegiate level, once said, "All natural birth has a purpose and a plan. Who would think of tearing open the chrysalis as the butterfly is emerging? Who would break the shell to pull the chick out?" Many of those cases where the baby is forced out before it's ready end in a C-section. Babies born through C-section compose 1/3 of the children in the U.S. today. Think of a family that you might know with 3 children. One of those 3 will have been born through C-section. As Elliot Main, an MD and chairman of the Department of OBGYNs, once said, "While some C-sections are absolutely necessary for the health of the mother or the baby, the high C-section rates in our low-scoring hospitals are unsupportable by professional guidelines and studies of birth outcomes." Moms won't think of hospital bills while they're pregnant. They'll think about how to design the nursery, how to organize the house, what to name the baby. All the while, as the hospitals see that mom's name on the delivery chart, they see dollar signs. And when a C-section is added to that bill, those dollar signs get a lot bigger. It's convenient to forget to mention this when you're inducing a mother at 37 weeks. But women who have a C-section have increased medical issues. Trying to care for a newborn with aggravating stitches has a higher chance for infection. That means the mom will be going right back to the hospital, giving them more money. Now that we know what those numbers mean, let's look at a more convenient choice for the mom as we discuss natural options. As we discovered earlier, natural childbirth is with minimal to no medical intervention with a focus on what feels natural for the mom delivering. Majority of people think that childbirth with an epidural, the pain medication, that labor would be easier and less painful. Sarah Buckley, a family physician adds that a conventional epidural will numb or block the sensory and motor nerves as they exit from the spinal cord, giving very effective pain relief in labor, but making the recipient unable to move the lower part of their body. I cannot imagine what it would be like to go through child labor not being able to move your legs or feel anything that's going on from the waist down. An epidural causes the brain and the body to miscommunicate, and when that happens, the body cannot tell the brain when it's ready to push. This leads to another medication called oxytocin. Oxytocin causes contractions in the woman's body. An opinion of Chris Kresser, an MS and one of the world's most influential people, said that synthetic oxytocin can interfere with the delicate orchestration of the mother's natural hormones during birth. So those two drugs combined prohibit the mother's body from producing the hormones naturally. Those are only two examples of intervention that almost always leads to technical intervention, like a C-section. But there is also benefit for the baby without having medical intervention during childbirth. When the baby is born, they will be less groggy and more alert. Their eyes will be opened and they will be more aware of what's going on around them. Women who do get an epidural during their pregnancy have babies whose eyes won't open for 3 or 4 days because their tiny systems cannot process all the medications that we're pumping through the mother's body and in turn theirs. And without an epidural, the babies don't go through so much trauma. Artificial contractions from oxytocin push until the medication runs out. Natural contractions work with the baby. When the body's ready to push, the baby's pushed. If the baby is constricted in any way, the body doesn't push. They work together as a team. This isn't to say that labor will be without pain. I'm sure labor will be very painful. Just ask somebody that you know. But like any type of hard work, it's rewarding. And they also say that many women who give birth naturally have a strong feeling of empowerment during labor and a sense of accomplishment afterward. Every time they look at that baby, of course they remember the pain, but they also see that beautiful child that they made and the reward that they did it themselves. In closing, I would like to stress 3 points. Firstly, the U.S. is a huge leader in the world today, a huge industrialized country that's lacking something in the delivery room. This is where the convenience of having a hospital schedule trumps the quality of the labor for the mother. Secondly, of course it's easy to schedule a birth. Who wouldn't want to look at a schedule and know exactly the date and exactly the time and exactly the next mom coming in to do it all over again? But C-sections are increasing and the hospitals are making more money. For what? For their convenience, not for what's best for the mom. And lastly, moms' bodies are designed to do this on their own. They did it before we had medical intervention, and they can still do it now without being manipulated and drugged during labor. As stated by Peter Jackson, a registered nurse, a pregnant woman is like a beautiful flowering tree. But take care when it comes to time for the harvest, that you do not shake or bruise the tree. For in doing so, you may harm both the tree and its fruit.